All right, so we're looking at hip abduction max strength test using a handheld dynamometer. Because it's subject to user error and setup position, we need to be strategic and consistent in our setup. So a couple things. If we look at our patient, she's side lying, slightly rolled forward with her shoulders and her pelvis, with the hip in either a neutral or slightly extended position. Because the amount of abduction that she's in is going to be a determining factor for how much force she can produce, not only today, but also across time. If we want to track that, then we're going to need to be consistent with the hip abduction angle. So we like to use a small step or stool, as you can see here, with the foot slightly positioned into internal rotation. From a provider standpoint or practitioner standpoint, you're going to be over the patient with, in this case, a small step, so that we can really be in our CPR and or hip hinging posture, well demonstrated by Mickey. And then for the patient, she's also holding and stabilizing with the top arm, in this case her left, and then Mickey's going to go ahead and give us our cueing for our patient as we go into this assessment.
Okay, so now I just want you to push in while squeezing your glute and hold it for pushing as hard as you can for 3 seconds. Ready? And go. 1, 2, 3. Good.
Great. And then we also know that the rate at which she contracts can give an impulse into the device, which may also influence the reliability or the validity of the movement. So beyond the cues that he gave, the other things would be, one, holding onto the side of the table, preemptively squeezing her glute to prime that muscle group as the one that's going to actually be doing the prime moving. And then third to that would be having her gradually increase and ramp up and then sustain it for the 3 seconds that he described.